Following the birth of your baby, it is essential to dry your baby and keep the baby warm. Please remember to bring a newborn-sized hat into hospital for your baby to wear. The baby's head is where most heat is lost from following delivery. We will then place the baby on your tummy to keep the baby warm and feeling secure. This is called skin-to-skin contact. Skin-to-skin contact with your baby is very important following delivery. It keeps the baby warm, regulates the heartbeat and breathing, and helps to initiate breastfeeding. If your baby needs attention to help establish breathing, then the midwife will place the baby on the resuscitator. She may clear the baby's airway and give the baby some oxygen. This is quite normal following delivery, and she will return the baby to you as soon as possible. When your baby is born, a baby tag will be placed on your baby's ankle. This is a security tag and will make an audible alarm sound if your baby is moved to an area that is not permitted. A smaller handwritten band will also be placed on your baby's other ankle. Please ensure that the tags are not removed until you and your baby are discharged from hospital.
In relation to maternity, we also have a state-of-the-art baby tagging system, extensive CCTV, which is monitored 24 hours a day, 7 days a week. I have a team of guards who patrol the corridors and car parks. We're available should we need to be called. In relation to maternity, actually, I get none. This, for mums and dads, is very reassuring.
Very good security they've got here with the babies, because apparently if whichever entrance you get out, somebody's trying to shut the whole hospital down.
Following delivery of your baby, the midwife will perform a thorough check of yourself and baby. You will be offered refreshments, a shower or wash, and a change of clothes. You will then be given some private time alone with your partner and baby. But remember, you can always call the midwife should you need her. The following times are guidelines and will depend on how you and the baby are doing following delivery. You will need time to recover from the birth and make sure that the baby is feeding well before we send you home into the care of the community midwife. If you have a normal delivery without any complications, then you should plan to return home between 2 to 6 hours after the birth. If you have an instrumental delivery, such as a forceps or a ventouse, then plan for a 24-hour stay. If you have a caesarean section birth, either planned or an emergency, your stay will be around 48 hours. It is quite a journey for some babies to enter the world. Some babies are born a little shocked, and some babies decide to arrive earlier than expected. If this is the case for your baby, then we have excellent facilities in our neonatal unit, where your baby will receive exactly the right care by a team of experts.
You've got a great team of staff on the neonatal unit. We all work really hard together, don't we, Susie?
Yeah, we've got sisters, staff nurses, nursery nurses, and then obviously we've got all of the doctors, the physios, dietitians, a big multidisciplinary team. It's lovely working so closely with the families and interacting with them and seeing the babies go from being very, very poorly to getting bigger and hopefully well enough to go home. We have lots of thank you cards and the parents bringing the babies back, and it's wonderful to see them develop and become young people and children that are hopefully well.
Visiting on the neonatal unit is understandably very controlled. These babies need extra special protection from any external infections. We encourage parents, grandparents and your own children to visit, as long as they do not have an infection or have been in contact with any infectious people. This could mean a simple cough or cold, or more serious infections such as measles or chickenpox in the case of children. If you do not return home from the delivery suite, then you will be transferred to the postnatal wards.
One of the areas that I'm responsible for are the maternity inpatient wards. That's Foxglove, which is Ward 24, and Primrose, which is Ward 25. Foxglove Ward, we tend to have the mums that have had caesarean section, and Primrose Ward, everybody else. A lot of mums go home straight from delivery suite, but if not, then they'll be up with us on Ward 25 for an overnight stay. We have all the equipment and the staff that's needed to look after them, so if there's anything that they need, they've only got to ask.
On the postnatal wards, visiting is between 10 a.m. in the morning until 8:30 in the evening for your birthing partner. All other family and friends may visit in the afternoons between 3 and 4 and evenings between 6:30 and 8 p.m. No children under the age of 12 other than your own are allowed to visit. This is to reduce the risk of infection. We try to protect your meal times so that you can enjoy some peace.
Can't thank the staff enough for what they've done for us. Really can't.
I would recommend it, definitely recommend it to other people. Definitely. I mean, they've looked after my wife. They've been nice to my children. Car parking facilities are great as well. I mean, they've given me a pass for the week. I paid the first time, they give me a pass for the complete week. So I'm happy with that as well.
And it's just as thank for them, a year to the day of the 22nd next year, I shall come back in and bring a card like I've done with every single one of my children. They're absolutely fantastic, and I just thought we didn't have to lose so much contact. I wish I could just go up and see them regularly as I could, really.
We do not provide meals for partners, but we have several lovely dining facilities that staff, patients and visitors are welcome to use. If you leave the ward area, please inform the staff and leave a contact number, just in case we need to get in touch with you. The Trust operates a strict no smoking policy. However, there are smoking shelters which you may use. Here is our Café au lait room on the postnatal ward, which is a sitting room that provides a great opportunity for new mums to practice breastfeeding. It's an ideal place to mingle with other mothers on the ward, or somewhere to go just in case you want to get away from your bed. There is plenty of reading material available in here. Our peer support workers often spend time in here with new mums, offering support around breastfeeding. They also work across the community, so if you live in Walsall and you are breastfeeding, they will come and visit you at your home to help establish breastfeeding and help you with any other problems. If you have chosen to bottle feed, we provide sterilised bottles, but you are required to bring your own baby milk to use while you are in hospital. The spa shop does provide baby milk should you forget, and is situated on the lower floor. We are a UNICEF baby-friendly maternity unit. This means that we encourage and provide support to all mothers regardless of the method of feeding you choose. We encourage all babies to stay with their mothers at all times whilst in hospital, unless medical reasons require mums and babies to be separated. This has the added benefit of encouraging and supporting breastfeeding and gets you used to your baby's behaviour, and signals that let you know when baby is hungry, hot or cold, or just wants a cuddle. Before you and your baby are discharged from hospital, your baby will receive a thorough physical examination. This will be a top-to-toe examination which will be carried out by the baby doctor or midwife. Your baby will also receive a hearing test. This may be undertaken in hospital, or you will be given an appointment to attend a clinic in the community at a later date. The results will be documented in your baby's red book, which you will take home with you. If you and your baby are well, you may be discharged as soon as 2 hours so that you can further recover in the comfort of your own home with your family and friends around you.